Hi everyone, this is Nick Doleys. I'm the manager of the Doleys Clinic and a certified nutritional pain consultant. The views and opinions in the video that you're about to see are just that, views and opinions. We're going to offer some information, but always understand that before starting any supplement or exercise program, it's important to speak with a healthcare provider first and foremost. Understand that what you do with this information is entirely up to you. Hi everyone, this is Nick Doleys, manager of the Doleys Clinic and certified nutritional pain consultant. In the clinic, we receive a lot of questions. Oftentimes, patients reach a point in time where the medications are not quite as effective as they'd hope they'd be, or because of some side effects, they're looking for some more natural options. The good news is that a lot of these options exist, and I want to spend some time talking about a couple of them. One of the questions that I get more frequently is, what can I do for nerve pain? Widespread nerve pain. Now, the bad news about nerve pain is that not all nerves can regenerate, and it is progressive. It rarely starts in one spot and then stays there. And it's also unpredictable. Some people have constant pain, they feel it all day. Some people have it just sporadically. The good news about nerve pain is that there are some key components that we can address, and if we get on top of some of these things early, then we have a better chance of success. So let's spend a little bit of time talking about nerve pain. Now, in the videos when I discuss nutrition and when I discuss supplementation, one of the things that I like to do is make sure that you understand that we have a very specific goal to accomplish. Nerve pain is really difficult to diagnose because it can be associated with certain cancers, with HIV, certain medications may cause nerve pain. It can be associated with nutrition, diabetes. It can happen in just your arms and your legs, your hands, your feet, or it can be widespread. But there are a lot of different symptoms that are associated with it, regardless of where it starts. Numbness, tingling, pain, flame, prickling, stabbing, all of these things are associated with nerve pain. Let's talk for a few minutes about why this happens. Now, regardless of what the cause of nerve pain is or what the specific diagnosis is, there are four things, and one or more of these four things are likely happening in the case of nerve pain. One, the nerve endings have a lack of oxygen. Two, the nerve endings have a lack of blood flow. Understand that we have areas of the body that are designed to deliver blood. We have vessels that bring blood, oxygen, and nutrition to nerve endings. The nerve endings need this oxygen, they need the vitamins and the minerals, they need the blood in order to function properly and communicate with one another. Lack of energy production. At every cell, cells create something called ATP. Now, ATP is the cell's energy. It's kind of like what makes the cell move. It's like gas in the car. Inside each and every cell in your body is the production of ATP. Now, with nerve pain, we often see a lack of energy production, or we don't feel that energy because the nerve is damaged and that ATP may be leaking. Last, we have chronic inflammation. Nerve pain, regardless of where it is associated with chronic inflammation. And a lot of that has to do with the energy production or the leaking of ATP. Now understand that all of this works together. All of this works in concert. That's why I say that one or more of these things may be happening. In nutrition, from a nutritional perspective, if we have too much sugar in our blood, high blood sugar or uncontrolled glucose, what that does is it blocks the flow of oxygen and blood to the nerve endings. They then become starved and they start to die off or become damaged. So this is a prime example of how the way that we eat and what we consume over the course of a day can have a tremendous impact on our pain. So when these nerve cells are lacking oxygen, when they're lacking blood flow, they become starved, they become damaged. They then open up and begin to leak their fuel. I liken this to a propane tank. Now, if you're in your house and you're getting ready to grill and there's a leak in your propane tank, you're going to smell it. You're going to smell the gas and you're going to know that there's a dangerous situation that needs to be addressed. In the case of nerve pain, the same thing is happening. ATP, the cell's energy production, when it is outside of the cell, is one of the components of signaling danger to the brain. So you think about a fire, and the fire alarm is going off, but the fire department doesn't show up. It's the same thing. If we have this leak, if we have these damaged cells because they've been starved, they're leaking, they're sending out the signal, the fire alarm is going off, the brain knows that it's going off, and we feel this. This is the inflammation that causes those painful sensations, the numbness, the tingling, the stabbing, the shooting. So we need to address all of these components. So within that, there are three things that we want to make certain that we do. One, we want to make sure that we have healthy blood and oxygenated blood getting to the nerve cells. We want to make sure that we're not anemic. You can test for anemia in your blood work. The other thing that we want to make sure we do the second thing, is we want to control blood glucose or blood sugar. Now that comes down to primarily carbohydrate consumption. When we eat carbohydrates, insulin is released to clear blood sugar out of the blood. But if we continue this process too much, then eventually our cells become what's called insulin resistant. They don't respond to the insulin. So it's hard to clear the blood sugar out of the bloodstream. Before too long, we may become diabetic. Now, all of this starts, at least in terms of type 2 diabetes, with the overconsumption of sugary carbohydrates. So we have to be cautious of that in our diet. The third thing we want to make sure that we do is control inflammation. Now that we understand the components of nerve pain that we need to address, let's talk a little bit about some of the nutritional supplements that can help us get there. First and foremost is a supplement called phosphatidylserine, and we'll put links to some of the recommended products down in the notes below so that you folks can find these if you would like to try them. Phosphatidylserine is a chemical that is produced within the body, and it's produced for the sake of helping develop nerve cells and to help nerve cells communicate with one another. So it should come as no surprise that in the case of damaged and poorly communicating nerve cells, phosphatidylserine has a lot of research to support its effectiveness in relieving some of the pain associated with nerve damage. The recommendation for phosphatidylserine is 150 milligrams a day. Next, we look at acetyl L-carnitine. Now, carnitine is an amino acid. We talk in the class that we present to patients about essential and non-essential nutrients. There are essential amino acids. We have to have them. We have to get them from food. They are the building blocks of protein. Some the body can make, some it can't. Acetyl L-carnitine is a chemical reaction that happens with carnitine. Now, the reason that this is important to us is because acetyl L-carnitine, carnitine in and of itself, is really heavily involved in the production of energy at the cellular level. We noted earlier that one of the problems we have is that cells are struggling to produce much energy because they're leaking their energy source, ATP. Acetyl L-carnitine has been shown in studies to be very effective at relieving nerve pain as well as chronic fatigue syndrome at around 800 milligrams a day. Again, we'll put this down in the notes below with links to our favorite recommended products. Next, we have essential fatty acids. One of the components that we wanted to address was chronic inflammation. Now, essential fatty acids, omega-3, 6, and 9 fats, these again are components that we have to have. We have to get them from food. Most notably, the omega-3 fatty acids have been shown in research to reduce chronic inflammation to a very large extent. One of the problems with the standard American diet is that the fatty acids that we consume are out of whack. We consume a lot of chicken, we consume a lot of fish, we consume things that have higher omega-6 fatty acids and some other fats that when the balance is off, that's when it creates pro-inflammation instead of anti-inflammation. In cultures where olive oil is more heavily consumed, where fish is wild, where avocados and vegetables and things like this are consumed, it's not so much that we see a lower consumption of calories from fat, but we see a better balance of omega-3, 6, and 9 fatty acids. So for the omega-3 fats, what I recommend is to look for a product that contains both EPA and DHA, and it will say that on the bottle, and we're looking for a total of about 2 grams a day. Not 2 grams of each, but a total of 1 gram of EPA, 1 gram of DHA over the course of the day. Now, one of the questions that you may have is if you're preparing for a surgery or if you have issues with blood clotting and how the omega fatty acids and fish oils may thin your blood. Again, that's a reason to have a discussion with your doctor about what other medications you're on and if you need to stop taking these for any period of time. But for the sake of everyday inflammation control, essential fatty acids are essential. Myo-inositol. Inositol is a sugar molecule in the body that the body uses to help regulate hormones. Inositol has been used to assist with neurotransmitters. It has been shown to help with anxiety, with depression. For the sake of this discussion, though, what myo-inositol has the ability to do is help the body properly utilize insulin. Insulin is the hormone in the body that moves sugar out of the bloodstream. And remember, we want to control blood sugar so that we don't block the flow of blood and oxygen to our nerves. Very important. Myo-inositol at 2 grams per day. It comes in a powdered form. You can add a quarter to a half to a whole teaspoon to your drinking water, and it acts almost like a natural sweetener. Alpha-lipoic acid. Alpha-lipoic acid is a very important antioxidant. Now, when I talk about oxidative stress and we talk about nerves, one of the things that I like to think of is a pole that gets left outside. Over time, that pole starts to rust and corrode and break down. Well, many of the nerves in our bodies are myelinated, meaning they have a sheath or a covering that runs around them. So you can think about that sheath or that covering like the pole. Now, when our cells are producing ATP, part of that is a combustion process that produces oxygen and other gases. That's how we get to ATP. Now, if that oxygen is left unattended, it will affect the myelin sheath just like the oxygen outside affects the pole. It will become rusted, it will become open, and the nerves that are supposed to be protected are now vulnerable and open to attack. That's why we eat antioxidants. An antioxidant addresses the oxygen that's floating around in the body that needs to be cleared out or needs to be turned into something more useful. Alpha-lipoic acid is a very interesting antioxidant because it's one of the ones that can reach the brain. We have something called a blood-brain barrier, and when you look at different nutritional supplements, you may hear that come up. It doesn't cross the blood-brain barrier. Alpha-lipoic acid does, so it has widespread implications. It can help all over the body. Very effective for nerve pain specifically. Research supports 500 milligrams per day. And last but certainly not least are the B vitamins. Anemia is a lack of red blood cells. Our bodies use the B vitamins, most specifically B12, to help boost red blood cells, create red blood cells. If you've ever been in a physician's office or a weight loss clinic and they've offered you a B12 injection for energy production, that's the reason. It's because the B12, the B vitamins, can help fortify the blood and transmit nutrition throughout the body. And remember, the first thing that we wanted to address was sending oxygen and nutrition to the nerve endings. Now, as we look at this, what's listed out are 6 different supplements. So if you're not interested in trying, or if you maybe don't have the budget to try all 6 of these at once, there are a couple that I would recommend we start with. First, I would recommend that we start with phosphatidylserine, essential fatty acids, and B vitamins. From there, the second one that I would add is alpha lipoic acid. After that, acetyl L-carnitine, and lastly, myo-inositol. The reason that I add myo-inositol last is because we can do a lot to control our blood sugar with diet. If you have nerve pain, if you're struggling with nerve pain, exercise is critical. Take extra steps. Take 10-minute walks throughout the day. Control your blood sugar through your diet. Look to lean, healthy proteins and healthy sources of fats like almonds and avocados. Save the sweets, save the sugar, save the carbohydrates for later, and try to fill yourself up on the things that are going to benefit you first. There's nothing wrong with a sweet treat here and there, but we need to keep them here and there. Folks, I hope that this has been helpful. Again, we'll put links down below to the products that we recommend. If you have any questions, you can find us online on Facebook at the Doleys Clinic.